Sometimes those that are more sensitive may notice that the book that they were able to read, their Bible or whatever they were reading before with normal light, now requires them to put torch on top of what they are going to read before. In other words, they need additional illumination, a much brighter light to read than previously with the same glasses. Some of them will go to optometrists or generally eye doctors and change their glasses, thinking the problem is the glasses. They still find out that they need additional source of light to read what they used to read. Some can notice that, especially those that read frequently. And what does it mean? The reason that the damage to the nerve has gone to a level where what we call retinal sensitivity to light has diminished. So you need more light to stimulate retinal sensitivity for you to be able to read, because you need acute vision to read. Reading requires a lot of acute vision. You can do other things with some other vision, but want to read, you must have acute vision. And that requires that you have minimum quantity of your nerve fiber that are still healthy. So in such people, the first symptom they may notice is that they require additional light or much brighter light to read what they have been reading with normal light before. Those are the early people that can present at a stage when the disease is now in the advanced stage. A large majority of patients in our experience present when the disease is in the end stage, and they are now stumbling on objects, and they are looking at something they cannot see. There's a part of what they are looking at that they cannot see. We call it scotoma. It falls into the blind spot, which is not supposed to be. Or things appear cloudy. They can't see people's faces well. By that stage, the disease has gone far. This is what we want to begin to reduce for our patients, among our people.
All right, if you're just joining us, it is still Mind, Body and Soul right here on 92.3 Nigeria Info FM. Dr. Jeff is my guest for today, and the focus is on driving community participation towards getting rid of glaucoma blindness in Rivers State. Now, you can join the conversation live on X. We are at Nigeria Info PH. At Nigeria Info PH is our X handle, and our Facebook page is Nigeria Info 92.3 PH. Go there, watch us live. Most importantly, be a part of the conversation. You can drop your questions in the comment section, and in course of the conversation, I will read out those questions, those comments, and those contributions as well. Let us go into the meat of the matter today, which is strategies that will help drive community participation towards getting rid of glaucoma, especially among community dwellers.
Mm-hmm. Thank you very much. The key strategy for driving community participation in getting rid of glaucoma blindness, most important one, is raising awareness among community dwellers. Because when people have the right information, then they can take the right decision. So in doing that, I brought us some key goals that we must achieve. Number one, we need to have or to domesticate some existing fora, but particularly one forum called Glaucoma Association. And how do I mean by that? We have Glaucoma Association in different levels, but I'm not sure we have anything like that at the community level, like the local government level. Some teaching hospitals actually have an active Glaucoma Association that patients participate actively, they support it, and they do advocacy at different levels. Now, if we can have that one at a local level, and then we can get people who have benefited from glaucoma care, particularly glaucoma surgery with good outcome, we can get them to be like ambassadors for glaucoma or friends of vision, or whatever name they want to take, and work at a local level with the association, like a coordinating this. This is becoming important because glaucoma has become a real public health problem, and the burden of disease of glaucoma in terms of visual disability and blindness is not small at all. The bottom line now is that a lot of people that are relatively young in working age groups have been affected. And some of them could not even finish school. Some of them could not continue with their career. Some of them could not continue with their businesses. So it has got to, the profile is now at the public health problem level.
All right, Dr.
So that's
Jeff,
one strategy.
I'd like you to pause on that strategy. We need to go on a commercial break now. When we come back, the conversation continues. To stay tuned to us. Remember, on X, we are at Nigeria Info PH, and Facebook page remains Nigeria Info 92.3 PH. Stay tuned.
Dearest gentle listener, are you seated?
Welcome back to the sunny side. I still have Dr. Jeff Ajewole, Chief Consultant Ophthalmologist, here in the studio, and we're still focusing on driving community participation towards getting rid of glaucoma blindness in Rivers State. Now, before we went to the commercial break, he was highlighting some of the strategies, starting with the very first strategy on driving community participation towards getting rid of glaucoma. So, Dr. Jeff, please continue.
Yes, thank you very much. Still talking about how to raise awareness at the community level. One of the strategies we have given thought to is to increase the presence of eye care services at the local levels. As we speak, there are 23 local government areas in Rivers State. And if our information is correct, none of those local government areas have eye care services at secondary level. They may have some people maybe trained at level, but to really have a service that a patient can go, have a cataract surgery, or go, diagnosed for glaucoma, have glaucoma surgery. As I speak, there is no such facility in any of the 20 local governments in the state.
So they usually refer them to the state level.
Exactly. And going a bit further, as we speak, we have only 2 major referral centers for eye in Rivers State. You have University of Port Harcourt Teaching Hospital and Rivers State University Teaching Hospital. Now, having said that, of course, there are other private establishments, clinic, hospitals that are being manned by optometrists and ophthalmologists alike. But when you look at the population in Rivers State, from statistics that we have, the population in Rivers State, as of last year, estimated population was 7.4 million. And if you look at some of the constraints we have, like manpower, as I speak, there are only 25 qualified ophthalmologists in Rivers State, roughly, today.
Wow.
Yes.
Serving a population of over 7 million people.
Exactly. So when you divide it, you find out that Rivers State has only one ophthalmologist to 300,000 people. In more developed economies, like UK, US, and other places, they are even looking at how they can bring it to 10,000 people for one ophthalmologist. We are 300,000 to one ophthalmologist. Having said that, we have some trainees that are doing residency, and if we add another 25, it will make that the people that are medically trained to handle eye diseases generally, not just glaucoma, maybe in another couple of years will be about 50. That is assuming all of them stays in Rivers State. So that can bring our ratio maybe to 1 in 200 or 1 in 150,000. It's still much. But having said that, we also have optometrists. And the information I have is that we have roughly about 150 optometrists in Rivers State. When you divide 7.4 million...
Who are the optometrists?
These are the people that are trained like a first, or let me call them primary eye care professionals.
Oh, okay.
They do training about eye, they can give glasses, and they can treat some simple eye problems. The problem we have with some of our optometry colleagues is that they do not have enough training to be able to handle glaucoma. And we need to get down together in this matter, because not even all ophthalmologists can handle glaucoma well. You must either train as a glaucoma specialist or have special interest in glaucoma and be passionate about it, because ordinarily it's a thankless job. So as we speak, there is no local government area in Rivers, as far as my information goes, that has an ophthalmologist to serve a population. If you divide the 7.4 million by 23, you will see what you will get. You will get about 300,000 person average in each local government. Between 300 and 400,000 people in the local government. And they don't even have anybody. So, if the optometrists, the ophthalmologists, we add them together, it's still a sizable number. The question is, how do we spread the service so that we don't just sit down serving people in Port Harcourt, but get to other areas? The good news I'm hearing now is that government is making effort, or probably in the process of building what they call zonal hospitals in about 4 places in Rivers State. Bori is one of them. Ahoda is one of them. Omok and Degema. And we are hoping that when these hospitals are set up, they will be higher than what it used to be. I used to go and do outreach cataract surgeries in Bori in those days. I've also done it in Gokana in those days. But the facilities are not there. You have to carry everything there. Everything you need to do any work, you have to carry it. So if we have in the nearest future such zonal hospitals where you will have facilities, even if an ophthalmologist cannot be resident there, you don't have a full resident consultant there, then consultant ophthalmologists from different hospitals, both public and private, can offer service in such centers. So that will reduce the stress of all our patients having to travel to Port Harcourt to teaching hospital, either River State or University of Port Harcourt, and to go to all the very few private practitioners that are available. As I speak, the burden of disease is bigger than the facilities and the infrastructure we have at this time. So that calls for concern. And that is why we want the community to add their voice to this campaign by realizing that this glaucoma has come to stay with us. We are going to find a way as a community, united together, and fight it. It's not doctors and nurses and government alone that we have to do this. Community dwellers have to add their voice. They have to get involved. So that's the strategy. The most part is this one I talk about, raising awareness first by creating Friends of Vision or glaucoma ambassadors at government level. This has been done in Malawi before, but not for glaucoma, but for trachoma. I used to be a trachoma researcher many years ago. And one of the things that helped Malawi to get to glaucoma is they did this kind of model and created what they call trachoma caregivers in the community. They were elderly women, retirees of maybe retired administrators, retirees or retired public health officers who were volunteering to go from family to family to educate them about trachoma and to carry basic treatment for them. If we can have people like that at community level, then our fight against glaucoma will be more effective and will produce better results. So awareness is key. The next one that I think we should do, like I said, after increasing the presence of eye care services in the community level, is how can we create get more advocacy at important levels. In the last 2 years, the World Glaucoma Association, which are the people that organize World Glaucoma Week, have been talking about taking the fight against glaucoma to important places like the parliament. Go to government parliament and go and screen people for glaucoma. Come to radio stations like this place and come and screen people for glaucoma. Make glaucoma a topic that will be in the public domain. And many more people will speak about it. Given eye drops, they are using the eye drops, spending money. But At the end of the day, they're still losing vision. They have no information. We want to change that scenario and create a narrative that will help our people, even at community level.
Wow. This has been a whole lot, I must say. At this juncture, I'd like to open the phone lines. I believe a lot of people listening have questions to ask and possible contributions as well. But from all you have said so far, Dr. Jeff, I perceive a certain level of ignorance as one of the leading causes of the rise in several people coming down with glaucoma.
Yes, you are right. There's a lot of ignorance about the disease. Let me give you an example. One of my patients came to see me this morning before I left my clinic. She was already, the only eye she had already has the glaucoma disease, as it were. She has been placed on glaucoma eye drops. She was applying it. She denied knowing that she had glaucoma. In other words, she was pushing eye drops. She didn't know the reason why she was pushing the eye drops. She was worried that she has lost one eye. She's walking around trying to find out what is wrong with me. And somebody has already placed her on anti-glaucoma eye drops. The problem with that is that if a patient is not participating in his or her own care, she will not take responsibility for her health, number one. Number two, she will not prioritize it. And especially in the current economic dispensation, the day she has to choose between buying food and buying glaucoma eye drops, she will go and use her money to buy food, which is logical. And the disease will go on without check. So that's why it's important for us to raise awareness and defeat this ignorance. But that's not the only thing we need to defeat. We also need to defeat this narrative among people in the community, saying that glaucoma has no surgical care. In fact, I think it's a bigger problem. Misinformation is bad enough, but disinformation is a more dangerous one. People are being persuaded, those even that have been diagnosed with glaucoma, they are being persuaded that if they go and do glaucoma surgery, they will go blind. So they carry that in that mindset, and they keep they keep on putting eye drops, waiting for the day they will finally go blind. I've had patients that come to my clinics like that to say, but they told us that we should just be using it until either we die or we go blind. That is not the right narrative. We want to change the narrative in that community level.
All right. 0817-923-0002 and 0817-923-0003. Again, 0817-923-0002 and 0817-923-0003. WhatsApp and Telegram number is 0809-030-6416. Again, WhatsApp and Telegram number 0809-030-6416. The call screener is in standby. Take your calls first before passing you on to me in the studio. So when you do call, first voice you will hear will not be my voice, but that of the call screener. Muriel from Okrika. Hi, Muriel. Welcome to the sunny side. Go ahead.
Hi, BDW. Good afternoon.
Good afternoon, Muriel.
Good afternoon, Doc. Thank you for
Good
calling.
afternoon.
Look, the for glaucoma, when you go to the hospital, now I'm talking because I have someone, a very close person that has experienced this.
Okay.
When you go to UPTH, they test you and they will say you're a glaucoma suspect, and they will direct you to another facility to go and check if you really have glaucoma. Why does the UPTH, why do they not have the glaucoma machine, whatever it takes to test people and ascertain clearly that you are a glaucoma suspect? Rather, they have to send you to a private facility that costs more than 60,000 naira just to test if you have glaucoma. I don't know if BMS has the equipment to test to ascertain if you have glaucoma. But why is it? I want to find out the glasses they give you. Sometimes some people use these glasses for a very long time and just relax. Please, they say glaucoma does not have any cure. You just have to manage it. The eye drops they are giving us, they are giving them. Why is it that at least it does not treat it, reduce it, especially those that it has been ascertained that they have this glaucoma. Why does it not reduce? Why is it that nothing happens? They don't give you drugs and yet nothing happens. You use the glasses, yet nothing. It just remains there. Whether it keeps deteriorating. Why is it that at least they say it can be maintained? It's not maintaining. The goods they give and the does not maintain it. Rather, it keeps deteriorating gradually and gradually. Why is it that way?
Okay, Dr. Jeff.
Yes, I think it's an important question this listener has raised. Let me first of all correct an impression. The problem of glaucoma is bigger than any particular department in any particular hospital in our country today. That's why we want community participation in driving this disease as a cause of blindness down. Now, when we say a patient is a glaucoma suspect, it's a standard impression. It's not a diagnosis. It's a standard impression anywhere in the world. In other words, let me put it this way. Before we can diagnose glaucoma, there are 3 parameters we must have. At least 2 of them must be present. Number 1, we must see evidence of persistently elevated intraocular pressure that is above a normal range. That's important. As a matter of fact, that's probably the most important risk factor. Number 2, we must see evidence that this elevated intraocular pressure has started causing damage to the nerve that the patient is using to see. Number 3, we must see evidence that the visual field, that is, how much space a patient sees per time, has continued to constrict significantly, reducing the amount of visual field or the amount of space a patient can see per time. We don't have to add the 3, but we must have at least 2 of this before we can say diagnose glaucoma. So when a patient just has raised intraocular pressure, if that's the only parameter we have, we may say either ocular hypertensive patient or a glaucoma suspect. If we then see the patient on more follow-up visit and we are noticing over time that optic nerve damage is now accompanying this, then the diagnosis of glaucoma can be made. Now, one other issue that the person raised was about machine. Why is it that one hospital or the other does not have machine? Glaucoma is not necessarily a machine diagnosis. It's not. We need equipment that can help us, but it's not a equipment-driven diagnosis. There are clear, just basic eye examination can give some idea if a patient has glaucoma or not. Okay, I don't know the level of equipment that teaching hospitals have, but I think they have basic equipment that can diagnose glaucoma, and I'm sure that many of my colleagues are doing the best they can given the circumstances in which they are operating. The question about eye drops is being found over time that eye drops that are designed for glaucoma are not very effective in people of African descent. Yes, there are reasons for this. Number 1, the eye drops were developed by Caucasians or Caucasian pharmaceutical companies who use most of the time their own people to test and develop the eye drops. Number 2, the type of glaucoma that black people have or anybody of African descent is different from what the Caucasians have. Time will not permit me to go into details of that. Number 3, the eye drops are quite expensive for an average glaucoma patient in Nigeria. Number 4, we have issue of storage with some of these eye drops. Some of them, like those ones that are, we call prostaglandin analogs, particularly something like latanoprost, require to be in cold chain from the laboratory or factory where it is produced until it gets to the patient's hand. That will happen outside, but when it gets to Nigeria today, we don't have the level of power that can keep an average pharmacist shop can keep life for 24 hours and keep such eye drops in the fridge like a vaccine. This is the truth of the matter. Storage. And finally, compliance. We are not an African person, averagely, including me here speaking, we are not very good in keeping to prescription. So that is why, those are some of the reasons why eye drops are not as effective among us as it is among the Caucasian. Cost is issue. Availability is issue. Storage problem is issue. Compliance is issue. So eye drops are useful as a starting point. But all the studies that I've shown, even among the Caucasians, have shown that surgery have an edge over use of eye drop, even in the best of situation. That's why that is the way to go.
All right. We lost the call with Tom West. But how can glaucoma be avoided? Say, what's the right nutrition and lifestyle, and can it be passed from one person to another? Thanks and God bless. Chukwemeka send that in.
Okay, Chukwemeka has asked a very good question. Let me start with the last part of the topic. Can it be passed from one person to another? I've said it in this forum before that glaucoma is not infectious. It's not an infectious disease. It's a chronic disease. But it has a hereditary tendency. In other words, it's a family disease. When we find a patient that we are suspecting of having glaucoma, if he has a strong positive family history of glaucoma, like one of the parents have glaucoma, or worse still, one of his siblings have been diagnosed with glaucoma, our index of suspicion will rise more. So there is transmission of the disease from generation to generation. There's a gene in the DNA structure that code for glaucoma. That's the truth. That has been established. But the other question about do I remember?
Lifestyle and nutrition.
Lifestyle, yes. Generally, good lifestyle improves health generally. And glaucoma is not an exclusion. For instance, we do know that people that smoke have higher risk of any disease, including glaucoma. As a matter of fact, there is a disease we call alcohol, tobacco, and myopia. It's not a glaucoma in itself. But if somebody is already abusing alcohol and abusing tobacco, he has put his nerve in danger in case he carries the gene for glaucoma. The natural history of that disease will be faster in him between the onset and end stage of blindness. So lifestyle, fruits and all that are very good, not only in general health, also for glaucoma, because they are like antioxidants. Okay. So they help the body, generally speaking.
Okonkwo, turn off your radio set. Okonkwo is calling from Rumukuta. Welcome, Okonkwo.
Yes,
go ahead.
Costa, good afternoon.
It's Denise. Good afternoon.
I have a question. My question is, since our doctor is an ophthalmologist, what have the medical and the eye scientists done to discover the cause or the causes of glaucoma, so that within this discussion, he will now reveal them to us? Then we'll add it to this information, and then everything will go well. What have they done to discover the causes? Thank you.
Thank you, Okonkwo.
Okay, that's an interesting question. Let me start by saying that the question is asking is out of the scope of today's presentation, but I'll just mention briefly. There are genetic studies that have been able to locate at this point of the DNA where the genes that are coding for glaucoma actually are situated. And there are genetic engineering research going on to see whether we can determine at the early age, at the early onset, in a patient, in a child that's growing in the womb, whether it will carry glaucoma gene. But these are things that will take many years before we can get there. And there is no, let me now deal with the first question asked. There is no one cause or group of causes for glaucoma. Glaucoma on an average is a primary eye disease. What is my primary eye disease? It occurs on its own. We have glaucoma can be secondary to other issues like injury, like diabetes, like hypertension. It can be secondary. But the primary open angle glaucoma, which is the commonest, up to 75%, are not causes. What we have are multifactorial factors, like one, being an African. There is a race issue on it, especially male African. Two, age. Glaucoma to a large extent is also age related, just like cataract. Two, if you are short-sighted, there's a risk of developing glaucoma is a bit higher. Four, if you have anybody in the family, especially direct family like parents or siblings who have glaucoma, you are at a higher risk of developing glaucoma. I mentioned all those things in the past. These are some of the factors. But of all the ones that we worry about, the most important risk factor is elevated intraocular pressure. One of the reasons why glaucoma in black people is different from the one in white is that studies that have shown in the past that African people have slightly elevated intraocular pressure, statistically higher on the average than the whites. And that African people also have slightly bigger cup in their nerve than the white. This has been established in studies that have been done in the US in the past. So we are more vulnerable as people of African descent. Our business now is to find how can we begin to fight this problem, not at late stage, but even at community level, creating awareness, making the presence of glaucoma care felt at the community level.
All right. Good afternoon, Didi and the doctor in your studio, sir. You're doing a great job by sensitizing the public about this glaucoma problem. Please, what is the remedy for a glaucoma patient that is now struggling to read what is in the book? What can we do at this moment to fully restore back her sight? And how can the public get to you, sir? Again, what are the preventive measures against glaucoma? Can cataract lead to glaucoma? Steve from Port Harcourt.
Okay. We don't have preventive measures for glaucoma, as it were. As a matter of fact, glaucoma is not preventable. Our target is not to prevent glaucoma, but to avoid blindness from glaucoma. Glaucoma blindness is avoidable. Glaucoma is not preventable. Neither is glaucoma curable. Glaucoma is a chronic disease. Arthritis is not curable. Asthma is not curable. Hypertension is not curable. Diabetes, all these are chronic diseases. They are not curable, but they can be managed to a level when a patient can live with it and still have good quality of life for all the years that matter. If I don't know what I'm communicating to this listener. So our issue is not about finding cure for glaucoma or finding a preventive measure for glaucoma. No. Our issue is how can we help somebody who is vulnerable, who is at risk of developing glaucoma, to make sure that even glaucoma actually occurs eventually, we can deploy all the technology, knowledge, and skills that are available to stop that person from going blind. This is avoidable. That's where we should be. Not preventing or curing it. Now, in terms of treatment, like I said before, there are different levels. Eye drop has a place. It does not have a permanent place in glaucoma care today, but it has a place to see starting point. Laser treatment has a place. In many instances, eye drop and laser might do for some patients and can get the pressure to a level where the patient can live, can go on. But the most important, the most reliable treatment for glaucoma anywhere in the world, even among the whites, particularly among people of African disease, is surgery. Glaucoma is a surgical disease. This is the message I like to drive every time I have opportunity to be in public space.
All right, final question, and we're done for today. Unfortunately, that's all we have time for. Good afternoon to you, presenter. My name is Tony. Please ask your guest, what could be the cause of the blur vision of one eye? Is it connected to glaucoma?
It could be. Most of the time, glaucoma doesn't start in the two eyes all at the same time. It starts in one eye, and most of the time when we see patients with glaucoma in both eyes, we find that one is way ahead of the other one, and that's usually it. So my advice to this caller is, if anybody is experiencing blurring of vision in one eye, he should go and get his or her eye tested. One of the campaign's strategy in glaucoma care or in glaucoma awareness is get your eye tested. Anybody from the age of 40, 45, on a good day, whether you even have history of person having glaucoma in the family or not, should go and get their eye tested at least once in a year. With that one, there's a good chance that even eventually develop glaucoma will be taken care of.
You're tuned to your number one talk station, Nigeria Info. Welcome.
For that, Dr. Jeff, and to you, the listener, go ahead, please.
I want to crave the indulgence of my listeners and the station to say that we have a plan to offer free glaucoma and free cataract surgeries between now and September for as many patients as we can cope with. This is just as a giving back to the public as I celebrate 40 years of being in medical practice.
Wow.
This month exactly made me 40 years
that
I took oath as a medical doctor.
Wow.
So,
congratulations.
Thank you very much. We would like to offer free cataract and free surgery and free glaucoma surgery to as many people as we can cope with within the next 3 months.
Okay. Dr. Jeff Ajewole, thank you so much for your time, and thank you for the offer as well. He is a chief consultant ophthalmologist, and so far we have been talking about driving community participation towards getting rid of glaucoma blindness in Rivers State. Now, for those who may probably be interested in the free surgeries, is there a number they can call?
Yes. Can I put the number on?
Okay, go ahead.
0802 838 2044. 0802 838 2044 or 0703 078 7811.
All right then. Thank you so much once again, Dr. Jeff. Surprisingly, our time is far gone. Rivers Today comes up at 3, and thereafter, Hard Facts with Kalada Koro Batabo. Final words from you, Dr. Jeff, as we leave.
We would like everybody in our community to show interest in glaucoma, not waiting for anybody they know to develop the disease. It's with us, and we have to unite together to fight against glaucoma blindness. It's not the job of government alone. It's not the job of doctors and optometrists and nurses alone. It's a collective effort that can defeat blindness from glaucoma. Thank you.
All right, thank you so much. On X, we are at Nigeria Info PH, Facebook page Nigeria Info 92.3 PH. Instagram and Threads at Nigeria Info FM _PH. Follow me on X and Instagram at _Denise_Dennis. Follow my Facebook page, Denise Dennis, and my Facebook account, Denise Dennis Walu. I'll be back here tomorrow, same time on the sunny side. Do enjoy the rest of your day. Adios.